So Dr. Anjana Kaur's camera and thing doesn't seem to be working. So
we'll do it from back at Binayak. We are live, so we can start. I'll just talk to
So, good evening, ladies and gentlemen. Welcome to this vlog of East Kolkata Doctors Group. And today's vlog is about National Immunization Day. And we are really very pleased to have with us today two eminent gynecologists, eminent pediatrician, and a top-of-the-range physician who are going to illustrate to us the benefits and indeed if there are any defects of vaccinations. We will first go to Dr. Sujata Datta, who's a gynecologist, and we will be talking about cervical cancer vaccines. So is there indeed a vaccine for a cancer, Sujata?
Good evening, Binayak. It's interesting, the word cancer tries clear into every mind, and cancer happens due to lots of different reasons. But there is one particular cancer in our field, in the field of gynecology, which can be prevented, and that is the cervical cancer that occurs because of an infection.
So, what causes cervical cancer?
Now, cervical cancer is actually caused by a virus called human papilloma virus, which is actually a sexually transmitted virus, and it's acquired through sexual contact. The good news is that most people can get rid of this virus themselves because of the body's immunity. But there are a few, about 10%, who are unable to do that. And it's in these small number of women that the virus lingers on, and over a period of, say, 10 to 15 years can cause some precancerous changes that will eventually lead to cancer. So it's actually the infection by human papilloma virus which can lead to cancer in the longer term.
Right. But is everybody at risk of cervical cancer? Say young children, elderly, or is it just women of childbearing age?
So human papilloma virus can actually affect men and women. In women, it would, as I said, it's because of sexual contact. So obviously anybody who's never been sexually active, such as a child, will not be at risk. After you've been sexually active for a while, you could acquire this virus, and eventually this can lead to cancer. Cervical cancer, vaginal cancer, and in men actually, anorectal and penile cancers, oropharyngeal cancers, all due to the same organism, human papilloma virus, and all of these people can be affected during their...
So men also can get HPV, and men can also have the vaccine?
Yes, indeed. The vaccine is licensed for men, and in some countries it's quite widespread, like Australia. A lot of men and boys are vaccinated against it to prevent penile and oropharyngeal and anogenital.
So, is it recommended for use in men and women in India?
It is indeed, yes. It's more commonly taken by women, but the license is there for boys as well, and it's a good idea to do it and start taking it, so that because of herd immunity, the transmission rate would also come down.
So, what is the rationale for this vaccination? Does it actually save lives? Does it actually, is it something that's 100% foolproof, and that if you take this vaccine, you will never ever get HPV infection or cervical or the masculine cancers that you're talking about?
Yeah, it's actually got a very good success rate, but we have to understand that there are lots of species and subtypes of human papilloma virus. So the vaccine can only protect certain subgroups. The commonest subgroups are HPV 16 and 18, and then there are lots of other ones as well. So the present vaccines cover at least two of the commonest one, which cause 90% of the cancers. But there will be a small percentage which will not be covered by this vaccine. And for them, we have to continue doing pap smears every 3 to 5 years, so that the ones that escape the net can still be screened for precancerous changes and treated accordingly. But once the vaccine has been taken, it's actually very, very good. And it's been around for a good number of years now. And really, if the vaccination schedule is completed, then there are very few breakthrough cases that there are in the Scandinavian countries. They have registers monitoring that, and there hasn't really been any reports of breakthrough cases. So booster doses are not required so far.
So, but Sujata, the main thing that worries people, incidentally, I was posting about our vaccination program today, and in various groups, and I think one thing that tends to creep up in the minds of most people is: are vaccines safe? Do they have side effects which would make them deleterious to usage?
Well, if you follow evidence and science, then yes, we know that the vaccines are very safe. It protects you against a lot of infections, a lot of diseases, and eventually cancer. Of course, there's a group of people who don't believe in vaccines, and we've seen with the Trump camp going against COVID vaccine and anti-vaxxers, and then you have a huge epidemic of certain diseases that come because of people not taking vaccines. So the side effects are minimal, so there could be a little bit of pain at the injection site, a little bit of redness, but generally very safe. And WHO has recommended that this is a safe vaccine to take with no major ill effects.
Good. So I think we've had a very good overview of cervical vaccines. And I think, Sujata, thank you so much for being with us. We know you're on a very strong schedule today, and it's great that you could take some time off. So we'll let you be and let you go. But if there's any other questions, we will take that at the end of the program, and maybe Shamita can take questions for you if necessary at all. But we will move on from gynecology to pediatrics, and I think pediatrics is probably. Do you want to come and share the camera with me, Anjana? I'll pull the camera towards you, and ask you your questions while you. So the first thing that why is today being celebrated as National Immunization Day?
National Immunization Day is celebrated every year. This day, that is 10th of November, just to spread the awareness of the benefits of getting vaccinated and the plethora of diseases that you can prevent in the long run if you get vaccinated at the right time.
And what is the theme of this year?
The theme of this year is Vaccine Work for All.
So, in effect, vaccines should be given to every child possible. It should not be delayed in everybody. What happens if the vaccine is delayed, Anjana?
If vaccines are delayed, it's not the right thing, because vaccines are selected to be given at the right time for the baby or the child, because all children and babies are developing their immunity. They are not born with full immunity like adults, and therefore they are not as well protected as adults are. So they need the vaccines at the right time. You cannot skip or delay vaccinations if you can avoid them.
Right. And what vaccines are commonly used in children?
The most crucial vaccines in the first year of life are MMR, which is against measles, mumps, and rubella. Measles and rubella being dreadful. Measles kills about 40,000 children in our country every year, and rubella causes irreversible birth defects. And then there is the DPT, which is diphtheria, pertussis, or whooping cough, and polio, tetanus, and the polio vaccine.
But is polio that common in India anymore?
No, polio is eradicated since 2014, March 27th, but we still give the polio vaccine to protect us and give us the herd immunity so that the vaccine cannot, the disease cannot penetrate the community.
But, again, I will put the question that I asked Sujata just a little while back. there's always this group of people who are saying vaccines are not such a good thing. Vaccines have side effects. What kind of questions do you get, particularly about measles? We had this thing about measles causing autism. What is the kind of approach that you take to parents? What do you tell parents when they ask you these questions about vaccines?
No, measles is not connected to childhood. Measles vaccine is not connected to childhood autism at all. There was this controversy which has been retracted in 2010. So it's just not connected. But we do get a lot of tough questions where the answers are straight. Whether we can skip some vaccines, whether the vaccines have some components which are not good for children. These are the kinds of things that we get. And no, you cannot skip vaccines. It's not a good thing. You again put your child at risk of getting the diseases, and for also the disease, if they are infected, they spread it to others as well.
So it's also a question of herd immunity as well.
Herd immunity and others, they just spread it to others as well, So these are not what you want. So vaccines cannot be delayed. They are not related to autism. And vaccines, the components in the vaccines are so small that they do not pose any risk at all. And they are rigorously tested for efficacy and safety before anybody gets it. And if your children or child does get some reaction, they are minor, mostly slight febrile illnesses, soreness at the site of vaccination. They are
nothing long term.
Nothing long term. If anybody gets a seizure or an anaphylactic reaction, there are people to take care of it. And if your child has ever got a life-threatening reaction like this from a vaccine, we will not give the same vaccine again.
But vaccines are also available in the private sector, in the public sector. Are private sector vaccines better than the public sector ones? Or
no, the vaccines available in the government sector are as good as those that you can buy privately. The only difference is in the government sector, you only get a selected variety of vaccines.
Right. So thank you, Anjana. You've been very kind. And in spite of having a technical glitch, you managed to come back and give us very clear answers on what the pediatric vaccines should be like. And we will move on to another session this time with Shamita, who's a gynecologist. And Shamita, you have chosen to speak on TDAP. What is TDAP?
Yeah, so TDAP, commonly called as the Tdap vaccine, is a combination vaccine which provides triple protection against 3 bacterial infections in a single shot. So let's go by it. T for tetanus. Tetanus, as we know, is a fatal infection which affects the nerves, causes paralytic muscle spasms, and which can also lead to the death. Small d, which is the diphtheria, it affects the respiratory tract and the throat. And the AP stands for acellular pertussis, which is commonly known as the whooping cough. So Tdap basically is a vaccine which protects us against 3 dangerous bacterial infections.
So as far as TDAP is concerned, when should you give it during pregnancy?
Okay, so Tdap should actually be given in the 3rd trimester of the pregnancy between 27 to 36 weeks. And because it ensures a high level of maternal antibodies, which is passed to the baby before the birth. And this time, it maximizes the transfer of the protective antibodies to the baby. Next slide, please. Now I want to say why we should be giving the Tdap in the pregnant woman. So initially, we used to give the TT, that is a tetanus toxoid, or a TD, that is a tetanus and a diphtheria vaccine, which offered protection to the newborn and the babies against 2 diseases, that is the tetanus and the diphtheria. But TDAP, it additionally provides protection against pertussis. Now let us know what is pertussis. Pertussis is a highly contagious respiratory infection which commonly is known as the whooping cough, and it affects practically all age group people, but the newborn are at a higher risk of infection. And they also develop serious complications like pneumonia, seizures, which requires hospitalization, and it can also lead to death. So as a result, now we have two problems over here. Firstly, the newborns are very vulnerable to contact this serious infection from their parents, their siblings, their caregivers. All those who are handling the baby can give the infection to the baby. And here, the mother is the person who is going to be the most common cause causing infection to the baby. And the second problem over here is we start vaccinating the newborns from 6 weeks or 2 months of their age. So during the crucial time, the baby doesn't have any antibodies. Now, if we vaccinate our pregnant women in the third trimester with a Tdap vaccine, the mother produces antibodies. These antibodies are going to protect the mother as well. They passively pass through the placenta to the baby, and the baby is born with the protective antibodies till it is old enough to receive its own vaccine. So Tdap should be given to all pregnant women between 27 to 36 weeks or the third trimester of pregnancy, so that adequate antibodies are produced, maximum antibodies are produced and passed to the baby and even protects the mother.
So
Lastly, yeah.
So one thing that all everybody tends to ask: are they safe?
Yeah, they are safe. There is, and the efficacy is around 90%. And side effects, they can just get maybe a redness or with the usual vaccines, whatever they get, swelling in the arm. And otherwise, we are not scared of any kind of infection or bad effect on the baby or the mother. So we have a few take-home messages over here, Dr. Sinha. What I want to say is that Tdap should be given even if the pregnant woman has received her 2 shots of tetanus toxoid.
Right.
What happens to us is that patients who are coming, who have been showing in the periphery, they have already got the tetanus toxoid. They don't know that the Tdap should be given. So even if a 3rd shot of tetanus goes to the pregnant mother, it doesn't have a bad effect. It is better to give the Tdap than to avoid it. The second thing is that every time this woman gets pregnant, she should receive a Tdap vaccine because the antibodies wane off gradually in 2 to 3 years. And last, the important thing is that everyone, all the caregivers, all the people in the family, the siblings as well, should have received a Tdap if they have not recently received it. So in this way, we actually protect the community from getting the serious pertussis infection, which can be highly morbid and has a raised rate of mortality as well for the baby. So it protects the baby as well as the mother.
So what is coming through from all our experts is vaccines protect and vaccines are safe. They do not have any kind of. We've had the 2 gynecologists tell us about Tdap, and as far as cervical cancer, we've had the pediatrician tell us that yes, pediatric vaccines are a necessity and they do not cause any kind of side effects. They are perfectly safe. The reactions are mainly local. But I will move on to Shamit in a minute. But before that, Anjana, I want to ask you a question that's come up in the chat box for you. Is it true that some vaccines are not available in the public sector?
Yeah. The government schedule has only this number of vaccines, the rest are not available. But they are the most essential ones. The rest are essential, you need to give them, or if you can afford, yes. But they have the most common and the more crucial ones are available in the government sector.
Right. So we know for a fact that the government is looking after most of the things. If you need anything more, you can always get some things in the private sector. I think that's probably a little bit more expensive, and that's why it's probably
a bit more expensive. And not all vaccines are mandatory in the schedule.
Okay.
So the non-mandatory vaccines are not available in the government sector at all.
Okay. We will move on now to the adults, and we will ask Shamit Ghosal, who will be telling us about Shamit, influenza, pneumonia, shingles. These are the vaccines which are really out in public domain at the moment. How bad are these diseases?
Yeah. So I think just like in the case of children, you don't even think twice when it comes to vaccination. But in case of adults, I think we have a tendency to believe, oh, we'll take care of it. The body will take care of it. But if you look at the slide, the aging process starts after 30 years of age, which might come as a surprise to a lot of people. And the middle-aged individuals up to 65, if they have any additional comorbid conditions, as simple as a hypothyroid, as simple as hypertension, type 2 diabetes, they are prone to developing a number of diseases. Remember, at elderly population, the commonest cause of admission are two. One is due to fall and fractures, and two due to respiratory tract infections. So from the mortality and morbidity point of view, can I have the next slide, please? I think the next slide will clarify the situation a little bit more. Now, this is the hospital admission and mortality related to a simple thing like flu. A simple cough and cold that we are talking about. And this is directly proportional to the degree of vaccination or flu shots given or not given. So the deep blue are the areas who have done well, has the least amount of admission and mortality or death due to giving flu shots adequately, and the dark red are the regions where the deaths are high. Now, to put things in perspective, just in the year 2017, the Lancet paper says that 145,000 patients have died from flu in a country like USA.
Wow.
So that's where we are looking at. As a matter of fact, if you remember, you and me used to discuss in COVID, is it worse than flu or not? Which definitely means flu was a gold standard of the amount of mortality. And remember, the pneumonia doesn't happen ordinarily. It's a secondary bacterial infection to the flu that we commonly develop, especially in the backdrop of the poor immune response in this subset of patients.
So, what are the vaccine recommendations to reduce the development of these diseases? I think what is needed to say is that the vaccines mainly reduce the severity of the infections. It's not that they make the infections go away completely, but give us a perspective of that, please.
So I think you just nailed it. There had been the controversy that we face even from COVID times or even before was, I gave the vaccine, but I'm still having cough and cold. That's not the issue. Vaccines are given, one, to reduce the frequency of occurrence of the respiratory tract infections, one, and two, if you develop, the severity will be less, the hospital admission and mortality can be prevented. That's why vaccines are given. It's not given to cure or disease. So that should be clarified right at the outset. Now, in adult vaccination, can I have the next slide? There are actually three essential vaccines that we are talking about. One is the annual flu shots. Now, since we are in the Northern Hemisphere, the ideal time is between April to June. But if not, it can also be given later on in especially places where they face severe cold winter. So you can give it even from September onwards. But ideally, being a Northern Hemisphere vaccine, we are supposed to give it between April to June. So that's an annual flu shots. We are supposed to give it on an annual basis, preferably a quadrivalent one in preference to a trivalent vaccine. The second is pneumococcal, and we need to vaccinate individuals twice. Remember, from 18 years of age to 65, we normally supposed to give the 13 strain, which is called the conjugate vaccine, which have 13 subtypes. And after 1 year, we are supposed to give them the polyvalent vaccine, which has the 23 subtypes. So if you give these two, you more or less complete the vaccination unless you have severe comorbid conditions where a booster might be required after 5 years. However, if you receive the 23 strain after 65 years of age, then a booster might not be required at all. Now, these two are directly associated with morbidity and mortality. The third one, which is shingles, is not actually associated with a lot of mortality, but this is associated with significant morbidity in the form of pain and burning sensation, trigeminal neuralgia, and rashes, which is associated with severe discomfort. Not only that, it keeps on repeating. It's a very intractable disease. It keeps on coming back because it survives in the nerves. So that has to be given on, say, day one. Especially the recommendation in India is above 50 years of age. You need to give it, and after 6 months, you need to give a second shot. These three are essential. Others depends upon particular situations and the discretion of the doctor, especially like something like hepatitis B, which we consider individuals with chronic kidney disease, whom we are looking forward to might be going into dialysis or transplantation. So they are the one who should be given hepatitis B, or healthcare workers, dealing with syringes and are prone to develop hepatitis B.
So, Shamit, just delving a little bit more into the shingles or influenza or pneumococcus. So say somebody has had a pneumococcal pneumonia recently. would they be suitable to get a pneumococcal vaccine?
Yes, they would be. Even in case of shingles, suppose you develop a shingles now, you have to wait for a month or two, a couple of months, and then you need to revaccinate yourself.
So an infection does not preclude vaccination.
No, because they keep on changing their strains and they keep on attacking you. Whatever immunity you develop is for that particular strain, but you're not immune to the other strains. And that's why, when you're talking of pneumonia, you're talking of 23 or 13 strains or subtypes. You might not be infected by all of them, but you're actually getting protection from all the subtypes when you're taking them.
For our audience, Shamit, can you kind of demonstrate the benefits of vaccination in a particular disease which has been documented worldwide, say like influenza?
Okay. So can I have the next slide, please? And thank you for sharing the slide with me, Dr. Sinha. So again, I think you rightly said, let us just point on influenza when we talk about adult vaccination for the simple reason, it is something that we say it's such a simple occurrence, right? It's cough and cold. So I think if we can document that and its association with significant mortality and the effectiveness of the vaccine. Can I have the next slide? For example, what we see is seasonal flu. Remember, the quadrivalent vaccine that we give covers 4 actually, influenza type A and type B. Type A covers H1N1 and H3N2. And type B covers the young avatar and the other, I think, Victoria. These are the 4 categories. But the type B is the one of the strains are not there in the trivalent vaccine. So I don't know which one is going to come the coming year. And that's precisely why we see that depending on the strain, the efficacy of the vaccine can vary from as low as 28% to as high as 80%. But we do not react to the strain. We take the vaccine and protect ourselves. For example, if you can look here, the effectiveness, I think the most important slide is the one on the top, where you can see that near about in individuals in this 2014 study, you can see that you can prevent, or the effectiveness of the vaccination could be as high as 74%. Yes, in the elderly or in some individuals, it might not be that effective. But the effectiveness in reducing hospitalization and mortality ranging from 40 to 80% is a huge, not only from an individual point of view, I think from the public health point of view, I think it's a huge saving that we're looking at.
So there's a question for you, Shamit, and Anjana, you can also take it if you want. Is pneumonia a terminal event for children or adults? So Shamit, you go first.
I won't say it's terminal, it's life-threatening, no doubt. And especially if it's a community-acquired pneumonia. Nowadays, we know that we are getting multi-drug resistant pneumonia in the community. So definitely, with the rampant use of antibiotic for upper respiratory tract infection, we are facing this problem a lot. It's always better to get vaccinated. And that is exactly the reason why you need vaccinated. So to see to it that it's not a terminal disease anymore.
The same, it is treatable. Vaccines prevent and reduce the severity of the disease. But yes, for infants and newborns, it could be life-threatening also. But we have all the things now. We have the good antibiotics. We have everything, just in order to do it. But the only thing I have to say, which is not related to this, in the last 3 years due to COVID, or more than 3 years now, is millions of children all over the world haven't got a single dose of vaccine. So it's time for a big catch up, at least for children. And that is, though it's common, it's being done effectively. It's a lot of hard work, and everybody needs to do that so that we are back on track and the schedules are maintained. That's just one more.
So we'll go to you, Shamita. You have your last word as far as obstetric vaccines are concerned, and then we will call the show at an end. You have about 30 seconds.
Yeah. So I just wanted to add on regarding the flu vaccine. So we have added the flu vaccine in our immunization protocol for the pregnant women. And so it's like we give a flu vaccine in the second trimester. We give the first dose of tetanus toxoid, say, a month later. And after that, we give the boostrix in the third trimester, which covers all the 3 vaccination and protects the mother a lot. So flu vaccines should be taken. There are many patients who are a little reluctant to take it, but I would advise flu in pregnancy should be. Thank you, Vinay.
Thank you. Thank you, Shamita. Thank you, Shamit. Thank you, Anjana. And of course, Sujata, you who isn't here, I'd like to thank all of you for being wonderful panelists. I think we've had a wonderful show and we have reiterated the importance of immunization on World Immunization Day. Take your vaccine. It is safe. Follow your doctor's orders. Don't keep on postponing vaccination. Vaccinations work. Thank you very much.
Thank you.
Thank you.